This is NDTV, and you're watching NDTV 24/7.
Hello and welcome to our special coronavirus show, Living with COVID. As India sees a higher spike every single day in terms of the number of coronavirus cases, we all have to adjust to the reality of getting on with our lives as well. Living with coronavirus is our new reality, but how do we do it and keep safe at the same time? Well, medical experts join us on this show every day to answer your queries on how to get treated, on how to get on with the battle against the global pandemic, and also get on with our lives. Joining us today, we have with us Dr. V.N. Shah, who's a diabetologist and a business head of Zydus Hospital in Ahmedabad. We're also being joined by Dr. Dilip Gude, who is a senior consultant physician, a diabetologist and a critical care specialist, chief of the Department of Internal Medicine at Virinchi Hospitals in Hyderabad. He's also associated with the Hyderabad Super Speciality Clinic. We're also being joined by Dr. Pratik R. Nanavati, who's an interventional cardiologist and is associated with the Bridge Candy Hospital as well as the Bhatia Hospital. Thank you very much indeed, doctors, for being with us on the show. Let me begin by asking all three of you what steps you're taking in your clinics and hospitals to make them safer for patients as well as healthcare workers who are battling on the front line of this COVID pandemic. Let me begin with Dr. Shah. Can you explain how you manage patient queries when the patient has to come to the hospital for checkup?
We are having the three kind of the screening. Once the patient is coming with the ambulance or the ER, we are having the COVID cubicles, and that is the negative air pressure cubicles are there. And at that time, at the time of the entry, we are screening primary. Those who are having the emergency, one fracture or something, even cardiac emergency or the neurology, we are asking them to go to the direct to the HRCT. And if it is a positive, then we are segregating that patient from the entry point of view to the directly ICU of the COVID patients. We are having the 14 ICUs in our hospital. At the time of the even entry also, second OPD patient, we are having this screening. So we are following the SMS, that is the sanitization, mask and social distancing. And we are having that kind of the at least enough area in our waiting also. We can do like the practice, we are following the SMS. So from the entry point, we are having the segregation of the non-COVID versus the COVID patients.
Right, that's a very good acronym to remember, SMS, which stands for sanitization, masks, and also social distancing. But Dr. Gude, let me ask you, can you please enlighten us on safety protocols at your clinic? Presumably that's a little different from a hospital which handles a far larger number of patients, but are they the same sort of precautions that you're taking also?
So I'm not working at my clinic for the last 3.5 or 4 months, given the lockdown situation, and clinics are not really ideal to see patients because there's a lot of crowding that occurs. Right. But I do practice at my hospital for 8 hours, and we follow pretty much what Dr. Shah has said. So it's basically, we have 2-3 entries, portal of entries into the hospital where any fever is there or not. We check for temperature, and if there is breathlessness, if a falling saturations, patient is directly guided to ER, to our emergency department. And if patient is afebrile without fever and without any symptoms, then he is allowed into the hospital. To the ground floor, we have an OPD where we have a pretty spacious outpatient room where the windows are wide open and there's a lot of ventilation, air and light. And then there's an 8 feet distance that we maintain. The patient wears a mask, I wear a mask, and then we have an acrylic partition, a see-through partition through which we can actually communicate with the patient. And then there's no auscultation that we do with the stethoscope because we try to minimize that direct patient contact. So only one patient is allowed. We don't allow any other attendant along with the patient. And even the waiting room, we leave out at least 2 seats when the patients are seated outside. So I think these measures have worked so far. I mean, there's no healthcare staff, at least in our hospital, or in my cluster where the staff are infected.
So my question to you, doctor, is in these COVID times, there are obviously anxieties that people have about going to clinics and to consult doctors. So what standard operating procedures do you have in place? What precautions are you taking to keep your clinics and your consulting chambers safe for patients and, of course, for yourself as frontline medical workers as well?
Well, in the case of hospital, yes, they do have facilities for segregation of patients at the entrance only, that infected patients are not allowed to mix with the patients who are non-COVID patients. As far as the practice of the patient goes in the clinic, in the consulting rooms, it's a different scenario. We are cardiologists, so we don't see infected patients. So patients who have got fever or symptoms history of COVID infection, we don't take them in the clinic. And when the patients who want appointments for cardiac evaluation in the clinic, we see to it that they don't have symptoms of COVID infection. On the phone, they are told to wear mask and come to the clinic. We take the patient by appointments only, so there is no crowding in the clinic. Nobody is waiting in the clinic. When the patient comes to a clinic, we check the temperature at the entrance. We give them sanitizer. The patient walks straight into the consulting room of the doctor without touching anywhere else. If the patient needs an attendant, then only one attendant is allowed to accompany the patient into the room. And the attendant then takes the patient to the doctor's chamber. An attendant then sits in a separate room away from the doctor's chamber and away from the common waiting area. There are no patients or relatives waiting in the common waiting area, only one patient taken at a time. Once the consultation is over, by and large it is with the social distancing and only question answer form. If there is need to examine the patient, then only the patient is taken on the bed for examination. Minimum time is spent for examination. And once the patient is examined, he is given prescription, he is advised, and the patient and the relative walks out of the clinic without touching anywhere else. Even the door is kept open by the staff so that they don't touch anywhere else. And once the patient is examined, the bed, the equipment, everything is sanitized. As a doctor, we also wear full PPE, face mask, shield, face shield, full PPE, gown, gloves, shoe covers. And after examining the patient, we sanitize our hands, we sanitize the stethoscope, whatever equipment is used, we sanitize. And once the patients are over for the day, the entire clinic is sanitized with hypochlorite solution. So this happens every day. In hospital also, they take similar precautions, and they are the patients who are non-COVID patients, they are kept in a separate department, and the lift also is different, and the waiting area also is different. So yes, they are separated.
Right. All right. Let's move this forward. For very many of us now, the time has come when we can no longer continue to be in strict lockdown inside our homes anymore. Many people are having to step out of their homes, go back to offices, to workplaces, to get on with business as usual in many ways. So, Dr. Gude, let me begin by asking you, for people who are actually going back to work, to offices, to shared spaces, how safe do you think are common facilities, for instance, like a cafeteria or a washroom in an office?
So it is strongly recommended that people don't visit these areas which have very poor ventilation, and because we know the micro aerosol theory now. Now, in a closed environment, it is possible for the virus to stay afloat in the air for a long period of time. So, in a cafeteria-like setup, I would not recommend lunch or tea or snacks. Workplace colleagues not to really go into the cafeterias. Minimize as much possible. In fact, even in our hospital, the lunchroom, we have not visited the lunchroom for the last 4 months. So, any area, for example, even the lift, the elevators. If there are 2 or more, people, we discourage anyone, going into lifts and all. So we encourage taking the stairs. So the bottom line being the social isolation norms that were there for the last 3-4 months. We recommend for everyone to follow those, even at workplace. In fact, even at home as well, if possible. So right. I think that's the way forward for the next 6 months at least.
Dr. Shah, as people start moving out, what additional precautions would you advise them, particularly while traveling? What if they don't have their own transport and they have to use public transport? What then?
It is a very nice question, I'm telling you, because Fortunately, I am one of the task force member of a government of Gujarat, and we are fighting with the corona like anything. Those who are in the diabetes, particularly in my field also, we are asking all the patients, those who are in the age more than 60, we are asking them to avoid to go outside their premises or from the home. Second, those who are doing their job, they are supposed to at least maintain this social distancing. That is the SMS I told you. They have to have, they have to carry with them the 70% plus alcohol sanitizer with them, and mask is must. Mask is a life for everyone today. Those who are having the diabetes, it is must under control, because you see comorbid conditions are very pathetic in our country, and even in our Ahmedabad city also, the cause of death is not the corona but the comorbid conditions like hypertension, IHD, CKD, or immunocompromised diseases, cancer, and uncontrolled diabetes. So once those who wants to go move out in their job also, they have to take regular their medicine. They have to control their blood pressure. They have to see their blood sugars are under control or not. And we are not asking the patient to come to the regular to the clinic. We are now doing the telemedicine also, and with that we are supposed to educate our all patients to at least take care of their health in this era of the COVID.
All right, thank you for that very comprehensive list of do's and don'ts. We will take a very quick break at this point and come back. And when we come back, we'll take a look at how to get on with our lives, and specifically for those who suffer from diabetes and heart conditions, what it is they ought to be doing.
Knowledge Partner, USV, your reliable healthcare partner.
Welcome back to Living with COVID. We're talking to our medical experts today, Dr. Gude, Dr. Nanavati, and Dr. Shah, on how to get on with our lives, even as we deal with the global pandemic. And it is now a protracted battle, but we can't necessarily sit back and not do anything either, particularly for those who already have existing conditions or comorbidities, as they are called. What is it that they should be doing? Let me begin by asking Dr. Gude, how can a diabetes patient effectively manage his condition at home, especially when it comes to lifestyle modifications?
Right. So, in fact, in the last 4 months or so, I have seen most of my diabetic patients gain weight in the lockdown because of lack of exercise, a little bit of overeating. So gaining weight in a diabetic patient is detrimental. It's very dangerous, in fact, because there's a condition called insulin resistance, which worsens. And in fact, worsening insulin resistance over a period of time can actually enhance or increase one's risk for cardiovascular disease. So keeping the weight to normal, near normal as much possible, and making sure they eat. In fact, lifestyle changes are very, very important. So when it comes to diet, having lots of low glycemic index foods, and then basically like a complex carbohydrate diet like multigrain, wheat or roti, then brown rice, and then lots of salads, basically vegetable salads, and then milk and egg white, for example. So eating such diet really is important, and snacking, healthy snacking in between is also important to make sure people don't overeat in the major meal like breakfast, lunch, or dinner. So coming to exercise, exercise is very important for a especially diabetic patient, because exercise helps lower one's sugars and in fact get a plateau of blood sugars. So diet and exercise are very important, especially during these times of extended lockdowns. And one more important thing is lack of vitamin D because of almost zero exposure to sunlight. So getting out some sunlight, and then working out a lot, then eating a healthy diet, and making sure one's fasting and post-lunch sugar levels are at the goal. And
Right. Dr. Nanavati, what advice would you give to cardiac patients in particular to manage their condition at home? Dr. Nanavati?
Yeah, the patient should understand that if stable cardiac patients follow the advice given to them, then they can have fairly symptom-free life at home, and they don't need to go to the doctor's clinic or the hospital. They should take their medicines regularly. They should check their blood pressure daily. I would recommend my patients to buy a digital machine and check their BP. They also, if nowadays with this COVID thing, they can buy a pulse oximeter so they can check their oxygen saturation and pulse rate also. They should follow their regular advice for diet, salt restriction for hypertensive, those who are overweight, those who have got increased lipids, they should have low-fat diet. If they're diabetic, they should also have a diabetic diet. They should exercise regularly. They should not put on weight. They should have adequate sleep at night. And preferably if they're elderly, they should avoid going out, because if they get infected, then the outcome of patients who have got heart disease is much worse than those who do not have heart disease. If they are forced to go out, then they should follow all the protocols. They should wear a mask, they should have social distancing, sanitize their hands, avoid crowded places, etc., etc. And in case they have any fresh symptoms or signs, chest pain or blood pressure or whatever, alteration, then they should contact the doctor and take the medicines according to advice. So if this is followed, then by and large they can have fairly symptom-free life, and they can avoid going to the consulting room or the hospital.
Right. Dr. Nanavati, one quick follow-up question. A lot of patients who are dying at this point of COVID also seem to be dying of heart attacks. Now, is there a correlation between the two?
Yes, the COVID virus affects the heart in many ways. As far as the heart attack is concerned, the COVID virus is known to cause extensive intravascular coagulation. That means multiple clots are formed in the blood vessels. The clots block the vessels and the blood supply to the organ is stopped, so the organ gets infarct, so the patient gets heart attack. COVID virus also causes inflammation, and that leads to often plaque rupture. Plaques are fat-laden deposits in the coronary arteries, and when there's a plaque rupture, the artery gets blocked, so the blood supply to the heart muscle goes away and the patient gets a heart attack. Also, sometimes there is what is called a cytokine storm. Now, when the COVID virus affects the body, it stimulates the immune system to produce cytokines. Cytokines are secreted by the immune cells, and their job is to kill the virus. Some people have got excessive secretion of this cytokine, what is called a cytokine storm. So apart from killing the virus, the cytokines, they damage the cells and kill the cells of the body, leading to damage to the organs, and even the heart can be affected, and you can have a myocardial infarction. Also, sometimes indirectly, when there is a severe infection of virus, then that causes severe lung damage. There is severe hypoxia. And this hypoxia, along with increased demand on the heart, that puts so much strain on the heart that the heart fails and one can get a heart attack. So it affects the heart in multiple ways.
Right. Dr. Shah, what about breathlessness and fatigue? Now, these are common problems that seem to be associated both with heart disease and with COVID. How does one distinguish then, when we get these symptoms, should we be worried?
You have rightly mentioned, you say, once the person is having the COVID, the oxygen saturation is going down. So that's why I think the previous speaker also told us we have to have our blood pressure at home. Then the pulse oximeter is a must for every house now. Once the person is having the symptoms of the fever, throat pain, shivering, even change of the taste or the no taste while taking the food, or sometimes if they have breathlessness, even simple person is having a normal lifestyle. Once the person is going to the toilet and coming out of that, and person is feeling like the breathlessness is there, then they have to check their pulse oximeter, and if it is a 94 or below, they have to consult their doctor immediately, and if they are not available, then they have to rush to the COVID hospital immediately. So we have to rule out, is this the cardiac problem or is this the COVID problem? With the symptoms plus oxygen saturation, the COVID problem is there. If the blood pressure is high, perspiration is there, blood pressure related problem is there, and there is no symptoms of the COVID, then person he is supposed to contact the cardiologist, and they have to rule out both the condition parallelly.
Right. Dr. Gude, one quick question to you. Is there any special advice you would like to share for patients of thyroid disorders in COVID times? Are they at greater risk?
Yeah, anybody with thyroid disease, now thyroid diseases are of two types. We all know it is hypothyroidism and hyperthyroidism, where hypo means the thyroid gland is secreting less amount of thyroxine, and hyperthyroidism where thyroxine hormone is secreted more. So both conditions, they need to be very wary of what can happen, because extremes of these thyroxine levels in the body can actually take a hit on the immunity. So one needs to measure their TSH, the thyroid stimulating hormone, and make sure they are on the right dose of thyroxine hormone if they are hypothyroid, and then if they are hyperthyroid, they need to take the medicine to bring up TSH levels to the normal. Yes, they are at increased risk for COVID, to contract COVID, and yeah, sorry about that. So yes, most importantly, thyroxine levels, thyroid profile needs to be done at least once in 2 months, and make sure they're in the normal range.
Would you recommend this for those who have existing thyroid conditions, or also for other patients who are worried that they might have acquired a thyroid problem from during this time, even if they didn't have a pre-existing?
Now, if there are symptoms basically of hypothyroidism, which is cold intolerance, then gaining weight, then skin changes and all, then if there is a high index of suspicion, definitely they need to get their thyroid levels checked. And those who are existing thyroid patients, they need to get their thyroid profile done at least every 2 months, and make sure they are on the normal range.
All right. Dr. Shah, how do you effectively manage hypertension in these COVID times? And, one question that keeps coming up, are ACE inhibitors and ARBs safe in COVID?
It was previously, because you see COVID virus is acting on the respiratory tract infection on ACE2 receptors. So previously it was a debatable thing, but now the ACE inhibitors and ARBs definitely beneficial to the even COVID patients also. We have to have the tight control of the blood pressure at any cost. So that's why we have to have our own machine at home. Previously also, those who are not having the blood pressure, even WHO is telling, check your blood pressure. It was a last year's slogan. So everybody, those who are having the blood pressure or not, regularly they have to check their blood pressure and have at least their systolic blood pressure below or around 120 and diastolic blood pressure around 80. So this is the recommendation of the WHO also.
All right. Thank you very much indeed, Dr. Nanavati, Dr. Shah, and Dr. Gude for being with us on this program today. We covered a range of issues, from going back to work to actually the management of diabetes, of hypertension, of cardiac conditions. And we've also learned a useful acronym today, SMS, for sanitization, masks, and social distancing, one that we should probably keep in mind for times to come. Thank you very much for watching.
Knowledge Partner, USV, your reliable healthcare partner.